No, this is not a medieval torture device. This is a vise called a Mayfield skull clamp that's designed to keep the head steady during brain surgery. Now take a look at this person on the right side. You can see that he's holding the patient steady while the other person on the left side is manually placing this vise on the patient's head. Now once the skull clamp is in place, you can see that the surgeon takes a hold of the patient's head, not the clamp, and keeps the position of the patient exactly where they would want it for surgery. And then the person that was on the right runs around and goes to secure the patient and keep them in that position. You can see that the skull clamp is connected to this arm, which has 3 points of motion. And while the surgeon is keeping the head steady, the assistant is securing all 3 points of movement, ensuring that the patient does not move. We would typically position a patient like this if we're going to perform a suboccipital craniectomy, where we remove the bottom portion of the skull to make more space for the brain. Alternatively, this can be done for something called a posterior cervical instrumented fusion, where we place metal screws and rods in the back of the patient's neck. Now, some surgeons can also use this device for long procedures, even if they're not doing brain surgery or neck surgery, just because they don't want to put any pressure on the eyes.